Namaste. I am Dr. Jayarajan. I am an Ayurvedic doctor from India. Traditional Ayurvedic assessment and diagnosis. It is very comprehensive. From the Vedic wisdom of India, Ayurveda provides an elaborated, simple ways of assessing the health condition by looking at various expressions from our systems. We have observation, touch, and questioning, three main modules of Ayurvedic assessment and diagnosis. In that, in observations, there are certain key indications what we can get from our own system. For example, the expression of the eye, lips, tongue, skin, nails, urine. All these organs expresses our internal health. So if you are closely observing your own system, you will be able to find if there is any specific issues happening inside, anything growing inside. I would like to give you few tips on certain indications that may give an idea on certain conditions happening inside. About eye, the grey whitish ring you can see around the pupillary, the scleral area. It's an indication of excessive sugar or salt intake. When you exceed your limit of sugar intake, you can get into that kind of a grayish whitish ring in the scleral level. If your eye is yellowish in color, it may be an indication of a liver problem, because hepatitis, jaundice kind of condition gives that bright yellowish discoloration to the eye. If a person is constantly blinking, that indicates a high anxiety level, nervousness, and fear. Whereas drooping of eyelid is an indication of insecurity. See, our organs, our body parts gives us the indication of what is happening inside. So your organs, sense organs, and your system, external systems are the mirror of your internal system. Now coming on to the nails. The longitudinal cracks or brittleness of your nail is an indication of malabsorption or malnourishment. Malnourishment, it doesn't mean that you are not eating. Malnourishment may not be because you are not eating properly. Malnourishment can happen due to problems with digestion, absorption, and utilization. You may be eating natural, balanced diet. You may be taking a lot of vitamins and minerals, whatever required. But if your system is not digesting the food and whatever you taking in, if it is not getting absorbed properly, if it is not getting utilized properly, you still show the deficiency even after taking whatever care you can. So the longitudinal split or the brittleness of nail may be an indication of your improper absorption and digestion. If it is transverse, this line or the depression is transverse, that shows some chronic disorders inside your system. When somebody is having chronic or degenerative issues, the nail can get that kind of a mark which is transverse in direction. Now about lips. The blisters forming is herpes that indicates the weak immune system, whereas the whitish grey small ulcers forming on both the junction of the lip may be an indication of certain deficiencies and malabsorption again, improper nourishment of the system. Brownish or greyish spot on the lips may be an indication of intestinal worms, and that can also happen if there is a delayed digestion or if your system is not absorbing certain key nutrients. Now, urine. Urine gives a real mirror image of certain conditions inside your system. Yellowish or orange color urine is an indication for gall or liver issues. But we know that if you are taking vitamin B or such tablets, you may get yellowish tint if there is no problem also. But if you have yellowish and or orange color urine with yellowish tint in your eye is a real indication of a hepatic issue, whether it is hepatitis or jaundice. Turbid, thick turbid urine is happening in certain metabolic disorders. Diabetes is one of the most common conditions that can give little bit thick and turbid urine. If there is froth, if there is foam or froth formation when you pass urine, you should check for any protein drainage through the urine. It happens in diabetes and other conditions. Microalbuminuria, the albumin, the protein, drains through the urine. If there is protein drainage through urine, when you pass urine, you can get the froth, the foam will develop in the. So, very simple indications or very simple to assess. Very, very simple to assess these symptoms, the indications of your nail, urine, lips, eye, tongue. If there is white coating over tongue, Ayurveda says it is a clear indication of a slow digestion and metabolism. Your digestive fire is not up to the mark, so the food what you are taking, it is not getting digested and absorbed properly. And improper digestion causes absorption of improperly metabolized, improperly digested food particle to the system. That may further lead into many problems, including diabetes or cholesterol or various other health issues. If there is cracks or the lines developing on the tongue, that indicates the chronic issues inside your body. Maybe a chronic arthritis or maybe a chronic degenerative problem. See, There are lot of indicators in our own system to express what is happening inside. So we should closely watch ourselves. We usually say, based on the classical Ayurveda, that we should find some time to look into ourselves. That gives one a clear indication of many of the problem that can happen inside the system at the very beginning, so that you can avoid going into serious health problem. That is one. Second is, there is a self-aligning system inside. When you listen to yourself, automatically it realigns. Many a time we hold our breath when you face problems or stress. Some areas we tighten our certain muscles, shoulders, neck, lower back, we tighten. That can later on lead to aches and pains and problems. So when you sit quietly, watch your breath, listen to yourself, look at you for 5 minutes in a day, that will help for a natural realignment as well as to see what is happening inside your system. At least you can keep 5 minutes for yourself in a day to see what you are. Thank you.